For doctors and nurses, have any of your patients surprised you with their amount or lack of pain tolerance? Story 1. A friend told me an old boy came in with a large laceration on his arm. Suturing it up took over an hour, but can be quite fun as you can chat with the patients. My friend was engrossed in talking to him about his experiences in the Second World War and really enjoyed treating him. The old chap was in good spirits throughout and told him lots of interesting stories about his time behind enemy lines or in trenches in Flanders. After it put the last stitch in, my friend started clearing up and found the local anesthetic bottle unopened. He realized he'd not put any local in at all, and yet the guy didn't once flinch, leave aside complain. When asked why he didn't say anything, he just said, "Oh, I thought that's how it's supposed to feel." I didn't mind. Lovely chatting to you. Then walked out. Don't make him how they used to. Spoke to my friend, and I totally didn't do this story justice. The laceration was sustained in a machete attack. 2 guys tried to break into the man's house and one slashed at him, but he fought them off long enough until a neighbor started to run over and they scarpered. Such a relevant detail, I could have forgotten. He had to clean the wound out thoroughly, which is even more painful than suturing. Story 2. For Doctor Here. In my intern year in residency, I saw a 17-year-old kid who, while playing hockey, tried to stop a puck with a gloved hand. It struck his fingertip, injuring the base of his nail and causing a significant deformity. His nail bed needed repair, which requires first removing the nail. That is done by separating the nail from the tissue below it. If your stomach didn't turn reading that and imagining it, congratulations, you have no soul. Typically, we use a numbing agent to eliminate sensation to the entire finger using something called a digital block. I put it in. After 10 minutes, he still felt me touching his fingertip. I tried putting some around the nail. He still felt everything. His mother said his father actually had a similar thing. Lidocaine didn't work on him. I offered him a different numbing medicine. We can inject Benadryl in that case, or even knocking him out. He looked me in the eyes and said, "Doc, just take it official." Without anything? Yes, it's fine. They fix our cuts without numbing medicine. But it's going to hurt. A lot. I have to scrape. I know. So I went at it. He grabbed a towel with his other hand, and I went to work. 45 minutes later, the nail was official. He was repaired, and I replaced the nail in its rightful place. The kid didn't even make a noise. Story 3. Working as an EMT, I got called to a 64-year-old female who slipped in her house, possibly sprained ankle. When we got there, the woman is sitting in a chair with her legs stretched out in front of her. But she has long pants and slippers on that covered the entire ankle, so I couldn't really see it. When we walked in, she was talking and didn't really seem to be in any pain at all. So I figured this was going to be an easy trip. I kneeled down in front of her and take a closer look. And wasn't I surprised to find that it wasn't just broken. It was up. I mean, the foot was at a 90-degree angle to the outside. And it was also leaned down, so what should have been the side of her foot was facing straight down. And the bone that should have been holding the ankle in place was pushing against the skin on the inside of her ankle so hard that it was about to rip through. I was bewildered at the fact that at the moment she said, "It doesn't hurt. So I hope it isn't broken." She hardly made a peep on the ride to the hospital. 35 miles, very bumpy. Come to find out, she had multiple sclerosis, and that makes people feel pain differently. Story 4. Not a doctor or nurse, but this happened to me. I completely shattered my knee and part of my leg after I was running and slipped on some ice into a stone wall. I was with a group of friends and all they saw was my slide and hit the wall. They came over and asked if I was okay. In a normal voice I said, I couldn't move my leg. No tears, screaming or anything. No one believed me, but after a minute or two I convinced them to call 911. The whole time I was waiting for an ambulance, about 30 minutes. I was talking to them normally, and no one believed I was actually hurt until I started going in and out of consciousness. Right as the paramedics got there, I started to wake up. They got out and they didn't think anything was wrong until they cut my pants off and saw my femur was almost protruding out of my leg. I had no kneecap and the tops of the tibia and fibia were protruding out. They took me to the hospital. No substances in the ambulance as I was joking around with them. They asking if I'm allergic to anything. I told them, apparently, stone walls. They got me to the hospital and rushed me into the ER, and the doctors came over and were shocked I wasn't screaming or crying. Then about an hour after the initial injury, the pain finally started once they started moving the leg. About 3 doses of morphine because one wasn't enough. And one of them were all. I don't remember the next couple of days besides bits and pieces, but all the nurses and doctors told me I had one of the highest pain tolerances they've seen. Although I imagine it wasn't really my choice, mostly the brain just shutting it down because I was in so much shock and had so much trauma. Story 5. When my daughter was 5, she severed her ring finger in a door. I was making lunch for a picnic when she realized her teddy bear was in her room, and you can't have a picnic without a teddy bear. She went upstairs to grab it, but I heard a slam and one single blood-curdling scream and silence. I ran to see what was the matter, and my little daughter was sitting on the floor in front of her door covered in blood and staring at something. She looked at me and said, "My finger is off, Mama." I wrapped her hand in a towel, picked up her finger, and called 911. In the ambulance, the paramedic was asking her questions about how much pain she was in, and she told him that it's the most hurtful thing ever. But she was sad that she ruined Teddy with her blood. They ended up being able to reattach the finger, but her Teddy was ruined. I tried to wash him, but it didn't come clean. The whole upstairs looked like a murder scene. I even washed the blood off the ceiling. A few days later, the paramedic knocked at the door with the biggest teddy bear I ever saw. He gave it to my daughter and told her that she was the bravest little girl in the world. It was really sweet. Story 6. I had a patient, a 60-something male who had 3 of his fingers mostly amputated by a snowblower at about the level of the second knuckle. He came in with his fingers hanging from skin flaps and was totally stoic. Not only was he a 0 out of 10 for pain, but his vitals were also rock steady. No alterations in heart rate or blood pressure. He kept joking around about it. I just cut him official. They'll grow back. This guy remained a 0 out of 10 for the entire time, even when they just cut them official. His biggest concern was getting out of there in time to watch a football game. Badass. Stark contrast are the patients I get who scream bloody murder and cry when the blood pressure cuff is pumped up on their arm. Grown adults. Are you kidding me? Also, screaming and crying are only going to make your BP go up, causing that cuff to squeeze tighter and tighter. An Eastern European guy had a circular saw accident that cut his leg down through the muscle. The wound was about 8 inches long. Was covering trauma surgery that night and got called down to sew it up. Here had F him up, and I brought a med student with me, and I walked him through aggressively irrigating the wound, reapproximating the muscle, and doing a loose suture approximation of the skin. The student took some time and rereaded several sutures in the skin and muscle layers because they were too loose or tight, etc. After about 45 minutes, we were done. I asked the attending how much morphine he gave him so I could reduce. He replied that he didn't order anything yet and was waiting for me. The patient's last dose was in the ambulance hours ago. I immediately asked the guy how he was feeling while I'm injecting the S***T out of him with local. He said, "I feel fine." The guy didn't even flinch the entire time we were working. He was connected to a monitor and his heart rate didn't even budge. Story 8. When I was about 12, I fell on black ice and hurt my ankle. I knew it was bad, so I asked someone to call me an ambulance. I wasn't crying or anything when they put me in the ambulance. Paramedics told me, "It's probably just a sprain." I get my x-rays and bam. My ankle was broken in 3 places and my foot dislocated. I saw the paramedic as I was leaving the hospital, and he told me he thought it was nothing because I didn't make a beep. I did shed a tear about a week late because my leg was hurting. I get to the hospital and the doctor says, "We'll cut your cast off, but I don't think we're going to find anything." He leaves. The nurses take the cast off and my entire leg is green, black, purple, blue, and I'm pretty sure some new colors that no one has ever seen before. Also had a bunch of pressure blisters. So the doc walks in, looks like he's in shock when he sees my leg, then leaves without saying a word. Then a new doc comes in and gave me a cool cast that I could take off to air out and look at my leg. A pain tolerance tends to F me over. Also F that doctor. Story 9. I'm not an doc or nurse, but I work side by side with a doctor. I saw an 8-year-old boy come in with a compound fracture to his left humerus, upper arm. The first thing I noticed was him strolling in, not a tear or grimace on his face, blood pouring down his arm and a bloody rag held down near his elbow. The first thing I thought was he probably had a decent laceration to his arm. Pretty tough, but nothing too impressive. I get into the room and see that the rag was removed, and holy S***T, that's a bone sticking out of his arm. How the hell is this kid not bawling? How the hell did he just walk into the air barely cradling his arm? Right then I knew this kid was tough. Little did I know that he was about to become Superman. So I'm sitting there admiring this gruesome wound and listening to his backstory. Apparently the kid was out with a friend riding a four-wheeler when they accidentally drove into a ditch and flipped the vehicle. The kid was thrown and the quad rolled over his arm. This was about 4 miles out in the middle of nowhere over bumpy dirt trails. So of course he just jumps on the quad and rides the 4 miles back to his house with a bone sticking from his arm. Then his dad just leisurely drives him the 30 minutes into town to the hospital and strolls on in. The best part. When the doctor said that they needed an x-ray of the arm, he just casually asks, "Before you move it, can I get a little pain medication? It sort of hurts." Most bad **8-year-old I have ever seen.